Next, we're going to be doing an adductor release. So you'll need a block and a ball, and the ball is going to go on top of the block. You're going to be laying on your side, and all you're going to do is you're going to go ahead and wrap this leg around and have it rest on the ball. So you'll find a spot that probably doesn't feel too good, and all you're going to do is just hang out in this position. So you're working on an area that feels like it's a little uncomfortable, and all you're doing is just breathing. When you're breathing, you're focusing on lengthening and just letting go into this area. Try as hard as you can to just relax this area as you're breathing, doing this movement. To make it a little bit more difficult, you can shift into this hip, put a little bit more pressure on the ball so that you're putting a little bit more pressure on that trigger point. And then again, still just breathing into this area. If it feels like it's too much, just rotate away. And you're only doing it to a point that you're able to tolerate. If it feels like it's too much, your body's going to fight it. So find a pressure that's going to be comfortable for you. And you're just slowly breathing in this position. Now I'm really close to my pelvis right here, but you're also able to move a little bit further away. So a little bit further away, there's different points along this muscle that you're able to get. So find an area that feels a little uncomfortable, and that's the area that you should be working on. So again, either close to your body, that's going to target the muscle a little bit closer to your pelvis, or a little bit further away, that's going to get the muscle a little bit further away from your pelvis. Both areas can be areas of tension. If you're just starting off, I would suggest probably the area closer to your pelvis, probably with a lighter amount of pressure. So maybe even rotating back a little bit. And as you get used to this, you're able to kind of rotate into it a little bit more. These adductor muscles have direct attachments to your pelvic floor. If these muscles are tight or triggered, these can be pulling on your pelvic floor, contributing to the symptoms that you might be experiencing. Also, if these adductors muscles are tight, they're not going to be able to function like they're supposed to. And these muscles need to function with our deep core to anchor us to the ground, to be able to perform all different types of movements. This can be extremely vital in opening up your hips so that you're able to perform even better. This can be helpful in reducing pelvic floor symptoms. This could be helpful in reducing back pain. And this can also be helpful if you just want to improve your mobility, function better, and get more out of your workouts, just due to improving the quality of your